Hi, welcome to my channel. My name is Adora, and if you are just seeing this face for the very first time, thank you very much for stopping by. And I do hope that before you get to the end of this video, you will have a reason to subscribe. Please kindly press the red subscribe button and the notification button so that from time to time, whenever I bring out any new informative and entertaining topic, you will always be the first to know. And if you're an old subscriber, thank you very much. I do appreciate you. I appreciate your time. I appreciate your effort. I appreciate everything you do to keep this channel running. Okay, so today I'm taking you through the steps, what it takes to be a healthcare assistant, what you need to expect in that particular field, what to expect, and also everything you need to know exactly about working in the UK as a healthcare assistant. Okay, recently there was this route that has just been opened. Of course, I'm very sure if you are a very constant YouTube addict or watcher, or if you love to watch YouTube a lot, you must have come across a lot of people talking about the visa, the work tier 2 visa, work permit to work in the UK as a healthcare assistant. There is a lot of information now going on about it, but a lot of people have no idea what it takes to work as a healthcare assistant. A lot of people have no experience at all in that field, so they do not understand at all what the healthcare assistant thing is really all about. Recently, I was talking to someone back home, and she said, yeah, she's been hearing so much about this healthcare assistant route, work visa route, and she would like to come to the UK through that route. And I was like, oh, that's good, try it then. And she said, but actually I have no idea what it's all about. What exactly is a healthcare assistant? What are their duties? What exactly is expected of them? So for the benefit of those that have no idea what the healthcare assistant is, what the roles of a healthcare assistant is, this video is for you. Now, if you want to come into the UK as a healthcare assistant, I'd like you to watch this, because I'm going to be as plain as possible, as raw as possible. I'm going to be as factual as I can be. I'm not going to sugarcoat anything, because I believe if you want to go into something, it's worth it for you to know exactly what you are delving into. It's not for you to walk into it and at the end of the day you're like, oh, what have I got myself into and all that. So first things first, as a healthcare assistant, which is also known as HCA for short, you work in various places. You can work in the NHS, like that's the general hospital, a public hospital. You can work in private places, private facilities, private hospitals, or the care home, where you take care of the elderly. You can work in the GP surgery. You can also work with people people living with challenging behaviors, mental learning disabilities, and all that. So there are different fields where the healthcare assistants are wanted. So that's one of the reasons why this route was actually open, because they are in constant need of people. It's a very broad area. It's a very broad field. It's not only working in the hospital. The healthcare assistants are really needed in very various places. So, but before you get into any of these fields, into any of those places, it's important you know, and I'm going to be very honest with you. It's important to know that in most cases, the job of a healthcare assistant is not a very, very, will I say, a posh job. It's not a very fancy job. When I mean not a very fancy job, it's not a very I don't know how to explain it, but don't expect to go to work in your high heels or looking so all pushed up and glammed up. Or it's not a very glamorous job, honestly. It's a job where you, in most cases, you have to go dirty. And when I mean get dirty, it's a job where you have to, it involves, in most cases, it involves a lot of personal care, especially if you work in the care homes. Now, working in the care homes, these are people who, in most cases, are in their, the elderly. Some of them are already very close to moving on to the next world, moving on to the great beyond. And when I mean that, I mean none of them are already close to the end of their lives. And at this point, they need care. They need personal care because they can't do a lot of things on their own. They are fully dependent on you, the care assistant, to clean them up, to help them with their toileting, to feed them, to keep them company. Everything you would expect a baby, a baby to want, or a baby to depend on you for. That is exactly what you'll be doing for this set of people, for this category of people. So I remember the first time I worked as a care assistant. Honestly, I didn't know I was going to go back there because some of the things I saw, I was not very impressed. I was not very comfortable with it. I was not too sure I was going to even have a second shift, like I wasn't too comfortable with the personal care aspect, cleaning up after somebody, feeding somebody, and having to see that the person is drooling, saliva, and all that. And then, you get where I'm going to. But at the end of the day, I discovered that this is all part of the job. Because be you a healthcare assistant, be you a nurse, be you a midwife, whatever you are, as long as you work in the healthcare setting, you are definitely going to encounter these things in one way or the other. I remember when I was in the hospital, I remember when I was having my second child, my baby, and when I was in labor and I was due to have my child, I remember I messed up the bed. And it was the midwife that cleaned it up. It was not a healthcare assistant. It was not a nurse. It was the midwife who actually cleaned up the bed, tidied. The way she just did it was like, she's used to it. And she didn't show any sign of disgust or anything because that's the job. It's part of the job. You just do it and you move on. So first things first, if you are coming into this job, be prepared to see some shitty things. Be prepared to see things maybe you might not have been used to. Now, if your baby poos, if you have a baby and the baby poos or pees, you're definitely going to clean the diapers, won't you? Yeah. So in this case, be prepared to clean diapers. Be prepared to change nappies. Be prepared to change pads. Be prepared to clean someone up if the person goes to the toilet. Be prepared to dress the beds of someone that maybe has probably vomited on the bed or vomited on the floor. Be prepared to do things like this. So if you know it's not something you are used to, but you really want to get into this kind of industry, you will have to adjust because that's what the job entails. So you definitely have to adjust to be able to cope. So you'll be prepared to do all of these things. But the good thing about it is that you'll be fully kitted. You have to wear your hand gloves, you have to wear your apron, you need your face mask. So in one way or the other, you're going to be protected. But it's just to let you know that this is what you are definitely going to see. You are definitely going to see it if you're working as a healthcare assistant. That is it. So be prepared to get dirty. That's why I said it's not a very glamorous job. I remember the first day I went to work. I went, I dressed so posh, I dressed so clean, like as if I was going to work in an office. With my makeup, my lipstick, everything popping. Only for me to get there and I was like, there is no point, wasting makeup on this kind of job because definitely you will not, it wasn't necessary. It wasn't necessary for me. I just felt, well, just dress up, go do your thing, come back, have a shower, and that's all. But if you once you get into it and you are able to adjust, after a while, I tell you, you're going to love the job because, like I said, as long as you work in the healthcare sector, you're definitely going to see it. So don't say, oh, it's only the care assistants that do those shitty things, it's only the care assistants that clean poo, or it's only the care assistants that change pads or whatever. No, even as a nurse, you're going to encounter the same thing. As a midwife, like I said, you're going to encounter the same thing. So as long as you work in the healthcare sector, in the medical field, you are definitely bound to see one or two things like this, that might put you off. But with time, you will adjust. So be ready. Just be prepared. Just have it at the back of your mind that even if it is once a week, you are going to see something like this. So the next thing is, if you have problems with your ego, if you are the kind of person that feels too big to take orders from people, if you're the kind of person that is always saying, this, do you know who I am? Kind of people, do you know who I am? Do you know who you're talking to? How dare you talk to me? Do you know how many degrees I have? Do you know how many PhDs? This is, in short, this is not your job. And apart from not being your job, I don't think any other job in the UK is yours if you have this kind of ego issue, because you will be prepared to take orders from people, and most especially, don't be surprised, you might have to take orders from your juniors. Now, when I mean your juniors, they could be your juniors in age. Maybe you're older than them in age, or maybe you're even more qualified than them, honestly. Some of these people, they come into the healthcare sector, and you might be surprised to see that maybe your senior, your supervisor, or your manager is younger than you. I'm sorry to bust your bubble. You will have to take orders. If your supervisor says you have to do this one, you have to go to this ward, you have to go to this room, you have to take care of this person, this is your duty for today, this is your duty for tomorrow, you are definitely going to abide by those rules, because that person is your senior. This is not home. This is not back home where, someone will talk to you and you'll be like, do you know who I am? Do you know how old I used to senior you? Do you know I saw you, I gave birth, I carried you when you were younger? Do you know? No. You drop all that seniority stuff back home, and when you come here, you face reality, because here, nobody cares how far you've gone in life. I always tell my friends that the UK is a leveler. It will bring you down. Like, it will put you in the same category with everybody. So irrespective of how far gone or how far you've gone in life, or whatever qualifications you think you must have achieved, when it comes to jobs like this, or any job in particular, I think it's any job in particular in the UK, be prepared to calm down, be prepared to calm down, be prepared to bring your ego down. You will have to take orders from people. You will have to take orders from your seniors. You will have to take orders from your supervisors to keep the work going. Now, I remember one day I went to work, and then there was this lady that came to work. She's an agency staff, and one of the seniors was actually telling her what to do, and this lady got offended, and she was like, how dare she tell me to do this? See the way she's even talking to me, see the way she's even ordering me around, see the way she's even. And I am a kind of person, I don't like people to order me around. So honestly speaking, I prefer I feel there are ways you can communicate, and it suits the heart more. There are ways you can talk to me now, and I won't be offended. You can tell me, Adago, sit down, Jare, or you just playfully, and I'll look at it like a joke. But if you tell me, come on, get out and go and sit down, it sounds more like an insult. So it all depends on the tone. So when this lady came and said, oh, look at the way that girl was talking to her, can you imagine that small thing? Can you imagine that small thing? This one that I'm older than, this one that I'm... And honestly, I was there, I witnessed it all, and I found out that, to be factual, the girl didn't talk to her rudely. The girl only said, please, can you, and she even put please, can you go and go to that room and attend to the person in there? But this lady felt, insulted, because she looked at herself, she's bigger than this girl giving her orders. How dare you tell me to go to that room? Why don't you go and do it yourself? So I just called her to the side and said, well, just be calm, take it easy. If you need some space, if you need to calm down and then put yourself back together, because it was like a shouting match. They were both going on each other. I said, if you need to take some time out and put yourself together and come back to the job, that's fine. But try as much as possible not to create a scene here. People are sleeping. And so I've met a lot of people in this job that feels, oh, how dare this one talk to me like that? How dare this one talk to me like that? But like I said, in this country, you have to be humble. You have to bring yourself down. I'm not saying you should go down for someone to trample on you. No. I'm not saying you should lose your confidence. No, I'm not the kind of person that will throw my confidence in the air for someone to insult me. I don't take all that nonsense from people like that. But in certain issues, especially if the person is not even being rude to you, if the person is not being uncultured towards you, for Christ's sake, just bring yourself down, humble yourself, do what you are there to do, and leave. That does not mean you should take shit from anybody, but at the same time, that does not mean you should raise your shoulders above your head at work. Next one is taking care of your mental health. Now, this job can break you. Like, it can literally bring you down to tears. I remember those days when I used to go to work. I go to work. Sometimes the night before my shift, like if I have a day shift and I need to leave very early in the morning, the night before then I start having anxiety issues. I'm already worried about how I will leave the house the next morning to work. I'm already thinking about what the next shift would look like. I'm thinking about what I'm going to see, because every day is not the same. You might go to work today and you have a very pleasant day at work. It's all rosy, it's beautiful. The day is so easy. The shift is so smooth, no stress at all. And you go back and you're like, ah, God, I wish every day is going to be like this. But unfortunately, every day cannot be the same. And then you might go to work the next day and it's just so stressful. Everybody is on edge. You're kind of sober. You're not feeling it. The work is stressful. Things are not going the way you expect it to go, and you're like, oh my God, no, I don't want to work here again. This is going to be the last time. Sorry, it's not going to be the last time, because every day cannot be the same. So that yesterday was good and today is bad or is stressful does not mean it's going to remain that way. So the ability to maintain your mental health matters a lot. The ability to put yourself together matters a lot. You have to be able to take care of yourself, because here, nobody cares about you more than you care about yourself. That's just the plain truth. Especially if you are an immigrant, you don't have a family support. You don't have a proper support system here. You don't have family. You don't have friends. It can be very hard. It can be very difficult, because there's so many things you might want to do. Sometimes you might want to speak to someone. Sometimes you might want to call someone for moral help. You want to call someone for support. You just want this emotional support. You want someone to talk to, but there's nobody around. So if you're the kind of person too that doesn't have a family, maybe you don't have a husband, you don't have a wife, you don't have children, you don't have family at all, it's going to be very, very difficult, because sometimes the kind of things you see at work, you might go to work today, you attend to a resident, you feed them, you take care of them, you communicate with them, you play with them, you keep them company, and then tomorrow you go back to work and you discover that person who you spoke to yesterday is already dead. He's dead. Maybe the person died overnight. It can be mentally draining. It can be psychologically deflating. Sometimes you ask yourself, am I sure I can endure this? Am I sure do I have the strength to carry me through, to pull me through this? Because sometimes a lot of things you will see will break you. So it is you that will help yourself to stand. Because in the first place, if you're going through all that, if you're going through all that stress, it's important you talk to someone. Even if you don't have a family, talk to your supervisor, talk to your boss, talk to whoever your head is, your boss is at work. Explain to them what you're going through and tell them you need support. In most cases, they support you, they talk to you, they calm you down. They might give you one or two, sometimes they might give you some days off just to bring yourself together, to calm down, to get yourself together. They might give you words of encouragement, or they might send you for therapy. They might send you to places where they will talk to you, they will counsel you, on how to manage in the job. You go through counseling. And that's one thing again, if you're especially for Black people, they don't believe in counseling, they don't believe in therapy. If you're doing a job like this, you might need it, because your mental health matters. There are people that have gone depressed because of the stress of jobs like this. There are people that have anxiety issues every time they want to go to work. Which I've been in that shoes before, so I know what I'm talking about. There are times you might be so anxious. At times you might be so depressed. You might be moody, just because of what the job entails, what you're going to see. Just because of what you've seen before, or what you're passing through in the job, and things like that. So you have to take care of your mental health. It's very important in this particular issue, especially if you're working with those living with mental health problems. It's a different ball game on its own. These are people who have no control of what they do. These are people who, I have friends who have complained about what they've gone through at work. I have friends who have said a lot of things. I have friends who have even changed the line of jobs. They've left the mental health setting straight to pure residential care home because they feel that's a bit calmer. When you're dealing with the elderly, they are calmer. They're kind of weak. They depend on you. They're like babies. They're softer. But when you're working with those living with mental health issues, some of these ones are they are the younger ones. In most cases, the younger ones, they are they are more of the hyper type. They are still very strong. It takes a lot to work with this set of people. It takes a lot. So that is where exactly you need that mental health of yours dealt with. You need it taken care of seriously. So when you're working in a place like this, be prepared. You're going to see all kinds of things. You're going to see all kinds of activities that might be strange to you. You might see all kinds of people that will that will push you to the extreme. So it's time for you to consider that aspect. Another aspect is, which of course is very obvious, if you're coming to any country that has winter, be prepared to brace up the cold, especially those early mornings when you have to go for your morning shifts and you have to wake up very, very early. And like, especially if you're not driving, be prepared. As little as these things sound, or as little as they are, they all matter. They all help to shape what your work experience is going to be like. Because, sometimes people will be like, it's not the cold, I can manage it. And so, it sounds that easy. But imagine you waking up very early in the morning. You have to get to work, for instance, 7:45 a.m. So before 7 o'clock, you're already up and getting prepared, and then you open the door, woof, and it's the cold straight into your face, and you have to walk through all of these, and then sometimes even before you get to work, you're already depressed, because the winter alone is depressing. The winter is one of the most depressing times of the year. A lot of people have confessed this, that once it is winter, their mood changes, their attitude changes, everything about them changes. They get depressed. It's just like a lonely period of your time, of your life. So you have to be able to adjust to these weather settings once you arrive in the UK. Be prepared to know that the weather is another thing that will shake you. It will move you, whether you like it or not. Another thing you should bear at the back of your mind is that if you have not worked with people who, with toxic people, I think you should have to start bracing up, or you should have to start preparing your mind that you might definitely see this kind of people at work. Now, the job alone is quite stressful. Then coupled with people who are now toxic, that will make it even more stressful, or more depressing, or more, like they'll make the whole job look like a punishment. So you're definitely going to see this kind of people at work, because some of these people, some of your colleagues you might see at work, some of them are already going through the stress of the job. Some of them, it is due to the stress, due to the depression they're getting from the job, and they cannot control it. They cannot control themselves. They cannot comport themselves. They cannot handle the mental aspect of the job that they are going through. They pour it on you. They pour it on you, who is their colleague. They pour it on the next person to them. They just transfer their aggression straight to whoever is around them. So be prepared. You might have to meet this kind of people. But the only key to solving this problem, or to solving this issue, is just patience. It's just knowing that, okay, fine, you're going to meet this kind of people from time to time. Sometimes understand that it might not be their fault. Understand that it's the pressure of the job that is already getting to them. So you're going to see this kind of people. Another one you're going to definitely see is that if you're coming to the UK to do this job, your tolerance will be tested. Your patience will be tested. Your temper will be tested in different ways, because you're going to meet with different kinds of people. You're going to meet different kinds of activities, things you might not have experienced before. You're going to meet different kinds of experiences that you might not even pray to have again in your life. But because the job entails all this, it's definitely going to come. Now, when I say be prepared to be tested, in jobs like this, you have to be very patient when you're working with certain people. Now, for instance, I always like to use myself as an example, because I'm going to be telling you from experiences that I have passed through myself. I remember on one occasion, then I used to work with people living with mental health issues, and I have just started my shift that morning, and okay, I like to go through the care plan. And now, for those who don't know what a care plan is a diary which documents a partial medical history of the patient. So whenever you go to work, you go through this diary. The diary states what exactly is wrong with the person, how long the person has been on it, what the person eats, the kind of food the person eats, the kind of treatment the person needs. Everything you need to know about that person, about that patient, is documented there. So it helps you, the care assistant or the nurse or the doctor or whoever is attending to that patient. It helps you, it guides you on what to expect from that patient, or what to do with that patient, or how to care for that patient. So it's very important whenever you resume your shift, you go through the care plan to know exactly what has happened previously before you arrive at your shift. But this morning, which was very, very strange, because each time I go to work, I always go straight to the care plan to look at it. But this morning I forgot, so I just went straight, to this patient to discharge my duties. And on getting there, the first thing was, whoa! He just shouted at me, and he was a little bit aggressive, and it was I didn't expect it, so I was taken aback. I was caught unawares. I was really shocked. I was scared because I didn't know why he reacted that way. So I had to run out of the room, and I went to meet my colleagues and I explained to them what happened. Oh, then they explained to me, oh yeah, this is a new patient. He just came yesterday. He just came in yesterday, and they're going to brief us better about his situation later in the day. So this is a new person. I knew nothing about him. I just came to work and I met him. I didn't know he was going to react like this towards me, and I didn't know how to react too. So out of fear, I ran out of the room. So you see, in issues like this, it's you really need to take care of. If it were the old me before I came into this job, maybe when I was much younger, and I saw that kind of reaction towards me, I think what I would have done was to shout back at him. Yeah, because I think I would have shouted back like, me too, you do me, I do you too, But maturity and experience in the job taught me to be calm. No matter the situation, be calm. Be calm before you react. While you're being calm, be thinking. While you're being calm, be analytical. Analyze the situation so that you will know how to react. So the job is going to test a lot of things about you. It's going to test a lot of things you never knew you could do. It's going to test your tolerance. Like I mentioned earlier, if you're not the kind of person that likes to see vomit, people vomit, people drool, or people spit around, or you don't like to see, the number two doing it, the passing of feces and all that, this is where the tolerance aspect is going to come into. You have to tolerate those things. So it's going to test your tolerance. It's going to test your temper. Like I just said, if you're not calm enough, you might react harshly in situations that does not really warrant it, which is going to cause a big problem for you. It's going to test a lot of things about you. So at the end of the day, this job, like I say, and I always say to people, is not for the faint-hearted. It's not for the lily-livered. Let's be very, very honest. I don't want to sugarcoat anything. It's better you know what you are diving into. And then if you still want to go ahead with it, then kudos, that's a very good one. But it's not for the lily-livered. It's not for the faint-hearted. It's not just about serving tea and biscuits, because some people think, oh, it's not just old people's home. Just go, they want tea and biscuits. You made them a cup of coffee or a cup of tea, and you give them biscuit and chocolate. No. The unglamorous part of the job is more than serving the tea and biscuits. So you be prepared that all these are things you are definitely going to see. But like I usually tell people, if you have worked with family members that need care, like if you have an aged mom or an aged dad, aged auntie or uncle, and maybe at one point of their life they needed you to like assist them in things like this. Maybe an aged mom who cannot really help herself again, or who is dependent on you for such help. Then if you have done that kind of thing in the past, even if it's in an informal setting, yeah, I think you have an experience and I think you're good to go. I actually think you can do it. It's the only difference is that you're doing it to strangers, to people you don't know, and you're getting paid for it. So that's just the only difference. But apart from that, it's the same thing. There is nothing different from what you've done for your aged mom or aged dad than what you're going to be doing here. So that's just to take you through the shots. It's just to give you a short, a brief explanation of what you are to expect as a healthcare assistant. That is just what to tell you, so that when you're coming in, you'll be rest assured that yes, I know exactly what I'm going in for, and then you will enjoy the job. It's a very fantastic job. It's a good one when you get used to it. And when there are people that I know that have worked as healthcare assistants for years, I'm talking about people that have worked for like 5 years, 10 years, 13 years, and they are enjoying the job. They are really enjoying the job. And another thing I need to explain is that whether you're coming in as because some people think, oh, if you're coming in as a senior care assistant, you will not be doing any of these jobs. You think I'm answering the title senior care excludes you from doing the shitty things, or it's just gonna be you sitting in an office. Sorry to bust your bubble. You're gonna do exactly what everyone is doing. You're gonna do exactly what the care assistants are doing. The only difference between you and them is that maybe you will have more responsibility than them. If anything goes wrong as a senior care assistant, it falls back on you. You will be the one to blame because you are supposed to be in charge of that shift or whatever. So apart from that, you are all the same. You're doing the same thing everyone is doing. You're doing the same thing the care assistants are doing. You're probably going to do the same thing the nurse is doing, because in some cases too, when the nurses they give medications to patients, a lot of carers, especially the senior care assistants, are trained to give medication. So it's just almost the same thing. So that's just to take you through this short circle about what to expect as a healthcare assistant. And thank you very much for watching. I do hope you will subscribe to my channel in case I have anything meaningful next time. Thank you. Stay tuned and God bless.